One of the things that I recommend all of my patients do that are on a GLP-1 GIP is they have to get body composition scans, because I tell them this is for you. This isn't for me. I need you to know how much muscle you have and how much fat you have, because at the end of the day, it doesn't matter if you've gotten skinny and you fit into your jeans. What matters is, did you actually lose fat or did you just lose all your muscle?
Today on the We Share podcast, we're joined by Christina Finnerty, certified family nurse practitioner and GLP-1 expert. Welcome to the We Share podcast. I'm Julie.
I'm Alex.
We share ourselves and we provide a platform for others to share.
We believe everyone has a purpose and a story to tell.
And we're back on the We Share podcast. I'm Julie.
And I'm Alex.
And we have a repeat guest that we love.
Going to come in annually, or we need to get her in here quarterly, really.
Yeah, if I have to go to a doctor to do my annual, you have to come in here and do your annual.
I totally will.
Okay.
Yeah, well,
I will do that.
We're so lucky to have Christina Finnerty in the studio today. She's a nurse practitioner here in town for Ridgeline Medical. And she's just a wealth of information, like just a great source and advocate for females. And we wanted to dive in to start off our January Wellness Month and talk about all the things like GL1Ps, NAD, peptides, any peptide. But we're just going to pick her brain. We have some questions and she's just going to share. So welcome.
I love it. Thank you so much. Thanks for having me
you.
on. I absolutely love doing things like this. And what questions do you have? What do you want to know? Peptides are all the rage.
Yeah, well, they are, and they have been for a few years, right?
Yeah.
So a bunch of people got involved. What is it? Ozempic? There's another one, too.
Tirzepatide, Mounjaro, Zepbound, Wegovy. We want multiple names for everything, so we just keep everybody confused. But in essence, what those are GLP-1. That's semaglutide or Wegovy or Ozempic. And then there's GLP-1 GIP, so two peptides. That's what makes up tirzepatide or Mounjaro or Zepbound. So all the same thing. And then to further complicate it, because the government has come in really and doesn't want us to copycat those things that we get from compounding pharmacies. Now we add in things like GLP-1, GIP, B6 glycine, or we add B12, or we add NAD. And not me personally, since I'm not the one at compounding pharmacy, but there's a lot of different names, but they're all doing the same thing.
Yeah, it's confusing. It is confusing. It's almost like it's confused the market, and then other people think they can buy stuff online.
Yeah.
And that's not. So we want to talk about safety and what options are, and how you figure out if you need it or not. Or if it can help you.
Well, and it's one of those things it's super, super popular right now. However, peptides have been around forever. And in essence, our body is made up of over 3,000 different peptides. Peptides are just chains of amino acids. So if something has less than 50 amino acids, it's a peptide. If something has more than 50 amino acids, it's a protein. So, and so they're very simple, and they're just signaling agents in our body. So, for example, what is GLP-1? Our body naturally makes it. It is made in the intestines, and it is meant to help with glucose regulation, insulin regulation, but it has a half-life of seconds. So when we eat, it is increased, but it only lasts for several seconds. So about 20 years ago, they actually came up with the first branded GLP-1. So it's not even that it's new. It's been around for a long time. They just made it a more concentrated version, and it lasts longer. So the Ozempic craze that started in 2017, because they made it more concentrated and last longer, that's when they really saw the benefits of, it's for type 2 diabetes, but they saw the benefits if they gave it in a specific dose that, oh my gosh, all these patients with diabetes are actually losing around 15 to 18% of their weight. And so it then got FDA approved for Wegovy, which is the version for weight loss. It's the same exact thing. But because we like to make things extra complicated in medicine and extra complicated by the FDA, it needed to have a different name. It also keeps it extra expensive.
Yeah, that's what I feel like. It's expensive. So if you need it for your diabetes, it's cheaper, right?
No, it's actually the same price. It's very expensive for diabetes as well.
But one is covered by insurance and one potentially might not be covered by insurance.
And it depends on the insurance company. So again, lots of confusing things in the United States. But generally speaking, for Ozempic or Mounjaro, you have to have a diabetes type 2 diagnosis. And then certain insurance companies will approve weight loss medications like Wegovy or Zepbound. Zepbound is also FDA approved for obstructive sleep apnea. Wegovy is also FDA approved for metabolic fatty liver disease, for chronic kidney disease. So the bottom line is what I tell patients is do not be afraid of these medications. They're not new. We know a lot about them. There are lots of studies. And my outlook on GLP-1 and GIPs is that these are longevity medications. There are a lot of people getting these medications and taking them inappropriately. So my biggest thing with that class of medication is you can't just take it and eat whatever you want. You can't just take it and not exercise and not sleep and abuse it. So the reason that it's gotten such a bad name is that there is this huge amount of people that are getting it from everywhere. You can order it everywhere. And that's what really scares me is because we're going to have an epidemic of people that are, they have no muscle. So it's called sarcopenia.
They don't work out. And then they're like, well, I don't need to work out anymore. I'm like,
and what I tell those people is that they're just going to end up skinny fat. We have to build and maintain muscle. And so it's really, really important that if you take this class of medication that you're not just taking it and eating whatever you want. You have to have protein and quite a bit amount of protein. We need at least 100 grams. Like they say 0.8 to 1 gram of protein per body weight, per ideal body weight. And so there's so many people losing hair. There's so many people getting super skinny. They don't look good. They have Ozempic butt or Ozempic face. And you can get that on any of them. But here's what I love about this class of medication and why I don't want people to be afraid of it, but why I want people to go through the appropriate channels. There is so much research in longevity medicine that is showing these are cardioprotective and they are actually FDA approved from congestive heart failure.
Yeah, they always say it lowers your A1C. Is that what you're talking about?
So A1C is diabetes. And so that's your 3-month average of blood sugar. So it does definitely lower the A1C. And why does that matter? Why does A1C matter? I'm very stringent when it comes to A1C because that is the level of glucose in your body. And when it's too high, which 93% of the population has prediabetes and mainly insulin resistance, and a lot of people have prediabetes, which means that when you get that hemoglobin A1C done, if it is anywhere from 5.7 to 6.4, that's prediabetes. I would say the majority of my patients that I see these days have prediabetes, and then insulin resistance is having an insulin level over 6. That's also a very stringent number.
Say, okay, majority is 51 plus. Give us a range, more like 70%?
Yeah. It's really,
is that
really
tested
crazy.
In your annual, like through blood work or urine?
That's a good question. It's a blood work. And so generally speaking, when you get your quote unquote annual blood work, that's going to be a complete blood count, a comprehensive metabolic panel, a TSH, which is your thyroid stimulating hormone, an A1C, which is that 3-month average of blood sugars, a lipid panel, which is your cholesterol, which is a whole nother story. It's not just numbers that we're looking at. And then a urine analysis. So the A1C is a blood test and it's very easy to get, but I never order it without a fasting insulin because you can have a normal A1C for 20 years before you get diagnosed with diabetes because insulin is the key that unlocks our cells and lets glucose into the cells to be utilized. And most people's cells are already so full of sugar that then it just gets stored as fat. So one of the ways that GLP and GIP-1 work is that they are lowering the glucose, but they're also they're increasing the output of insulin for better glucose regulation. But the key with these meds is that they are also burning what's called visceral fat. So they're burning that fat around your organs.
Which is super important.
It's super important, and it's super hard to get rid of. And so we have a lot of people with fatty liver disease in the world today, which can lead to cirrhosis and fibrosis of the liver. And the treatment, one of the up-and-coming treatments, is the GLP-1 GIP. So I tell people I love it at a low dose, taken responsibly, exercising, sleeping, building muscle, getting protein, drinking water. Like, being healthy isn't easy. It takes a lot of work, but don't take it for granted, and don't take this medication if you're not going to put the work in, because you will end up skinny fat and gain twice as much weight back. Like, this whole epidemic of all these people losing weight but not changing lifestyle, it's really going to kick us in the butt in a few years. We're already starting to see it. You hear it. People take it.
I'm seeing it on people.
Yeah, they lose all the weight, but then they don't have access to it anymore, or they just decided to stop it. Their appetite comes back like bonkers because they didn't actually learn how to eat low carb, healthy fat, good protein, real food. Mm-hmm. And so it takes a lot of responsibility with all of the peptides. This is not something that people should be doing on their own. That's my personal experience. I don't agree with getting peptides from research companies.
Yeah, and they all say not for
human
not
consumption.
for human consumption. It's for laboratory research.
We're
I'm like, what are you even
huge-
putting in your body?
Right. Well, and that's just
Okay, this is news to me. Does it really say that?
Yes.
Yeah.
And there's no regulation.
So the people that are ordering it on their own are ordering it from research labs. And I know a lot of people out there that are listening to this, they're going to be like, well, I do it and it's perfectly fine. I'm fine. But here's what people don't know. You don't know where it's sourced from. A lot of it is sourced from China. It can have heavy metals in it. It can have toxins. It is not something that people should be messing with. I highly, highly recommend to see an actual provider that will walk you through those things. But even that, like, you can go online and pay somebody to get you these medications that really doesn't care about you as an individual. If they're not checking your blood work and they're not having you do body composition scans.
I can't tell you how many times I've had people say that. They're like, oh, I just got a doctor online and they just ordered it. And I'm like,
one of the things that I recommend all of my patients do that are on a GLP-1 GIP is they have to get body composition scans, because I tell them, this is for you. This isn't for me. I need you to know how much muscle you have and how much fat you have, because at the end of the day, it doesn't matter if you've gotten skinny and you fit into your jeans. What matters is, did you actually lose fat, or did you just lose all your muscle? Because if you get later in life and you've lost all your muscle is the key to longevity. We know now that muscle is what preserves our metabolism. The more muscle you have, the better insulin receptors you have, and the less fat you will have. But here's the other kicker with why does glucose even matter? Like, why does it matter if your A1C is pre-diabetic or even in the diabetes range? Just I'll get put on insulin. And no. If you get to the point where you need to be on insulin, forget ever trying to lose weight. Like, insulin is exactly opposite of weight loss. But that high glucose level is what causes cancer. So that's the big picture, is what is the leading cause of disease? Inflammation. And what is the biggest source of inflammation? Glucose. And what is the biggest source of glucose? Eating like crap.
Yeah. We just need natural sugars, not all these crazy things that we
need real food. And it's a huge problem. Even in teenagers these days, like, they're just used to eating fast food, and not just teenagers, everybody's busy, right? And it's so much easier to drive through the drive-through than it is to go home and cook a piece of steak or some vegetables, or even get a pre-made meal from like Factor, or I love Project Lean Nation in Idaho Falls.
Yeah,
They're
that's a new company.
so awesome. And for free, you can go into Project Lean Nation and get a in-body body composition scan.
That's what I was going to ask you, is like, where do you know that you can do that? I know we know Avanti Body. We both go there.
They absolutely do
and
it too.
They have the best system there, and I recommend everyone do that.
Everyone should know what their body composition is. It should be another vital sign. You should know certain things, certain blood work.
Blood pressure,
heart rate, but detailed blood work, not just your annual blood work. Like the annual blood work, I don't even know why it's considered annual blood work. It doesn't it's like the most basic of basic. You should know what your vitamin D level is. You should know what your insulin level is. You can actually track markers of inflammation. If you have high cholesterol, there's advanced cholesterol panels that can be looked at. There's just so much more that I really want to help people know, like, don't just get the basics, like really focus on mastering the basics of sleep and food and exercise and water and mindfulness and breathing. But back to peptides. We'll talk about all sorts of different peptides. Like that's the big question these days, but specifically for GLP-1 and GIP, they are amazing longevity medications. They are neuroprotective, so they're protecting our brain. And here's why, because your glucose level matters. And when it's managing your glucose level, then you have less inflammation in your brain and you're less likely to get dementia and Alzheimer's. Alzheimer's is called type 3 diabetes because it's a blood sugar issue. High cholesterol is, generally speaking, a high blood sugar issue because your body will lay down cholesterol plaque in order to protect your arteries from the inflammation that's really from the glucose.
Oh, it's so crazy how it's all connected.
It's all connected. We're so much more complicated than people understand. Like you can't just pick up a peptide and get instant. Anything that is instant gratification or too easy generally isn't going to be the best thing long term.
Right.
Yeah. You have to do it responsibly. Okay. But I don't want people to be afraid of it either.
That's what I was going to say. Mm-hmm. So let's lay the boundaries for GLP-1s.
Yeah, yeah.
And I know it's probably far more complicated than this.
Yeah.
But should people stay on them for years and years?
That in my mind, yes. But it depends on the dosage. And there's this whole big thing about microdosing. What does microdosing mean? That's a big buzzword. So microdosing in essence just means either the lowest dose, which is 0.25 if it's semaglutide or 2.5 if it's tirzepatide. The highest dose that tirzepatide goes to is 15 milligrams. That's a lot. Like 2.5 to 15, that's a big stretch. And what a lot of people are on this trajectory from their provider is you go on 2.5 for a month, and then you go on 5 for a month, and then you go on 7.5 for a month, and then you go on 10 for a month, and you go on 12.5, and then you go on 15. People don't need to be, generally speaking.
Are they doing that arbitrarily, or that's just the plan? Like
that is the way that the drug company came out and said that this is how you're supposed to do this medication. And so a lot of providers will follow that. Well, I would say 95% of my patients, because I see a lot of longevity, a lot of hormone management, a lot of preventative medicine. I'm not in like a diabetes clinic or a heart institute, but the majority of my patients are seeking me out for longevity and wanting to be their best, a better life. And you can lose weight on the lower doses when you actually make the lifestyle changes. So you don't need to be on large doses. So in my mind's eye, I do let people know this isn't something that you necessarily have to come off of. There is research that shows that long-term low doses are preventing Alzheimer's, they're preventing cardiovascular disease, they're preventing kidney disease, they're preventing liver disease. So there's so many, and it's anti-inflammatory. So many people with autoimmune diseases, I see them do exponentially better on the GLP-1 GIPs, specifically for that. Knee pain goes away.
If they're clean
Fibromyalgia.
ones.
If they're clean. Yeah. Mm-hmm. And yeah.
Gosh, I could have kept my boobs and just gone on GLP. Just kidding. I had to get that in there.
Yeah.
Maybe I'll get some again. No.
I'm going to be your good friend and say no.
I'm just sticking with the padded bras.
Yeah.
Yes. Yeah. No foreign objects.
Yeah, no foreign.
And not to say that they're bad for everybody, right?
No, it just was for me.
But your body just wasn't going to accept that.
Yeah. But that can happen with anything. I mean, you can have autoimmune we see so much more autoimmune disease. Yeah, it could be like a knee,
like a total knee replacement. I could reject something that they did in my knee or something.
So back to should people stay on them long term? Can people stay on them long term? All of the evidence thus far is showing that, yes, we can be on them long term. And every longevity conference that I go to, all these mainstream medical providers are turning longevity because we love the idea of helping people not put Band-Aids on things, but actually get to the root cause of things. And so those are the people that I surround myself with. It's always the way that I've loved to do medicine is let's figure out why. Like, what's your gut health doing? What type of food are you eating? How are you sleeping? What are you drinking? And so at every single longevity conference, whether it's a cardiologist, whether it's a ophthalmologist or a urologist or a orthopedic surgeon, all these people are crossing the line to longevity, and every single person, part of their protocol is generally a GLP-1 GIP just for the anti-inflammatory and longevity benefits. So they are very safe. They do have side effects. But again, those side effects generally come when something else is wrong. Gut health is off. And so people get a lot of dyspepsia or reflux or heartburn or constipation. So one of the ways they work is to delay gastric emptying. And that's why you stay fuller longer, i.e. you don't eat as much. And so that's why people lose weight is because they're in caloric restriction. But you have to make sure that you eat and quality nutrient-dense food with enough protein, or you're going to lose your hair, you're going to jack up your adrenal system. And yes, you have to have at least 100 grams of protein. You got to have 25 to 30 grams of real fiber. You have to drink enough water. But constipation's a big side effect. And so magnesium citrate, beautiful. Keeps the bowels moving.
Magnesium.
Yeah.
Can't live without it. Okay, Another question about the GLP-1s. Like, I'll talk to people who are on it or whatever, and they'll have nausea all the time. What's the reason for that? Why?
So the nausea, when I have patients that have nausea, again, I go back to what's your dose? And what are you eating and when are you eating? So if you're eating late at night, that food is sitting on your stomach and putrefying. So literally. And so the goal is always, even if you're not on a GLP-1 GIP, don't eat 3 hours before bedtime. Why would you eat right before bed and then expect your body to know what to do with that? It's just going to store it as fat, So
do you know what I always tell my kids about that? Because they've started teasing me saying I'm an old person because
you have to eat at 5:30 or 6.
5:30. Yeah,
totally.
I do eat dinner.
She's the early bird at the
I
diner.
get up at 4 and I try to do like a 13-hour fasting window.
Absolutely, yeah.
So they make fun of me and I'm like, when's the last time you pooped? Because I'm doing fine.
Yeah.
That's what I always say to them because they always have problems.
And
I'm
they're
like, it's
I don't
because
want
of
to
how
talk
you
about
eat.
Yeah,
poop.
your body is a machine. And so it'll regulate and do it as long as you're treating it right, I think.
Yeah.
So.
But nausea is a big side effect. However, that indicates to me that is poor gut health. So many people have poor gut health, which means there's something called leaky gut. And it is a product of our environment and what we eat. So all of the processed food, all of the gluten that is genetically modified, our body doesn't know what to do with it. So gluten is wheat, right?
Yeah.
And it's sprayed with Roundup. It's genetically modified. It's fake. Our body doesn't know how to handle it. Go to Europe and you can eat all the gluten you want because theirs isn't fake.
Yeah.
Our body attacks it and it causes GI upset. It causes things to get in that shouldn't get in, things to get out that shouldn't be get out, lots and lots of inflammation, nausea, not being able to poop. So when I see that, I say, okay, we've got to do another peptide. So one of my favorite peptides for gut health is BPC 157.
That's my favorite peptide that I want to be
It's amazing.
on again because I did the pill and then I did shots for a little bit to heal my shoulder.
Absolutely.
When I tore my shoulder.
I've seen nothing more miraculous.
And I just listened to another podcast about it today and it's so like futuristic.
Regenerative.
With longevity.
It is by far the coolest.
If you have anything ailing you, your body, it's just going to help your body repair.
Say it again because that's a new one to me, and so it's got to be new to other people. So say the peptide again.
BPC, it stands for Body Protective Complex 157. Another amino acid that our body naturally makes. It's made in our gut, and its main job is to heal. And so it is one of the peptides that can be taken orally and absorbed properly through the gut. And it is the number one thing to heal the gut lining. So if somebody has reflux, if they have heartburn, if they have nausea, if they don't poop, if they feel like garbage all the time, if they have chronic fatigue, it is something taken orally to heal the gut lining. It can be combined with other peptides. There's one called KPV. That one's also very anti-inflammatory. There's another one called lorazepatide. And so there's different groups of peptides that can be taken orally. And I always start with gut health with people. So if somebody's like, I'm just so nauseous on my GLP-1, something's wrong. That is a side effect. So you're either on a really high dose, you're eating too late at night, you're eating fatty food, too much fat. And fat's not bad. I love fat. It's my fave, but it has to be good fat.
Avocados. Give me some butter.
Yeah, it's got to be good fat, not processed seed oil like French fry fat. But that's usually why they don't feel good. Okay. So back to BPC. BPC can be taken orally and is very effective orally. And the thing with BPC is it increases the healing within our body, and it will go wherever it needs to go. So even when you take it orally, it will travel to where it needs to travel to heal tendons, ligaments, injuries. You can inject it, and it's a little subcutaneous injection. It's 5 days a week. You take 2 days off so your body doesn't get used to taking it too often. But say you have carpal tunnel, you have a shoulder injury, literally any injury, you can inject it subcutaneous. So that just means right underneath the skin with a little tiny insulin needle. And it really does heal tendons and ligaments. Now, is it going to heal like a ruptured Achilles tendon? No. But I have seen it do so many good things. Yeah, it really is one of my favorites.
Geez, if you can prevent surgery, goodness sakes, this is the way to go.
And it doesn't even have to be that you prevent surgery, but what if you took it pre and post surgery? Yeah. I have many patients that are like, I'm going in for knee surgery or I'm going in for back surgery. And I say, okay, let's do a pre and a post surgical. Let's get you on the right peptides to help you heal faster. A really good example is my son's really good friend just had shoulder surgery. And I said, okay, come on over. I'm going to get you some BPC. He is a patient. I did it correctly. But I had him inject BPC every day, 5 days a week for the month prior. And then the month after, he healed 3 times as fast as his friend who had the same surgery and was out of work for 6 weeks. Now, could it just be that he has better health? There's so many different factors. But is it going to hurt? No. But again, please don't just go get research peptides.
Do you have a preference though? Because peptides are all the rage, how do I know if I buy it at Amazon or locally sourced like pills versus the shots?
That's a really good question. And again, so I love Amazon. Amazon is at my doorstep almost on the daily. It's like my surprise because I don't know what I order. However, I absolutely do not order supplements off of Amazon. There is too many counterfeits being utilized or being...
Well, the packages all look the same.
They look the same. You don't know. And so I would say Amazon is absolutely not where I would get any supplements, and especially not BPC 157. I'm going to put out a couple brands that people can order on their own that I absolutely love and trust. One of them is called Level Up Health. So LVLUP health.com. Okay. They're an Australian peptide company. Amazing. The research is amazing. If you can go on their website and they have actual clinical research and they have actual medical providers talking about the sourcing, that's where I would get these things from. Okay. I wouldn't get it off at Amazon. I wouldn't get it willy-nilly. I would just really make sure that website has actual clinical documentation of where they're getting things from and real providers talking about it. Another one is called New BioAge, so NUBioage.com. They're actually a pharmaceutical company that has peptides that prescribers can order, but they're peptides that they have just for the general public. I really trust because, again, you can go on their website and see where is it sourced from. The thing with peptides is you want to make sure that they are third-party tested, that they have documentation, that they have sent this out to be tested, that it is clear of any heavy metals, clear of any toxins, endotoxins, things like that. So if somebody is going to order these things on their own, you want to make sure that it has that third-party testing. But even with research peptides, I absolutely do not agree with just anybody being able to get these research peptides. Because, I see there's gyms saying, we can get you your peptides. And there's, my son's 19-year-old really good friend who I love. And I taught him about peptides. But now he's selling them. I'm like, no.
At the gym, there are people that are doing that for muscle growth, like guys. And they're like, oh, I know a guy that gets
at the gyms. So injectable BPC 157, you should get from a legitimate medical provider who gets it from a legitimate compounding pharmacy. And what that means is we have these relationships with these pharmacies that are FDA regulated. They have oversight to make sure that they are doing it properly, that they are compounding it properly, that they are third-party testing it. So that's a safe way to get a peptide.
How much does it cost? Like 157 if you do it injection
correctly.
It really depends. And here's the other thing about getting research peptides, just like you said, like I got some peptides, right? It was $80 for the vial, but it was 2 weeks worth. So I'm not good at math, right? But you have to calculate how much bacteriostatic water do you put in, how many milligrams per ml, how many micrograms are you doing, how many units is there? And it's very complicated. So just ordering peptides willy-nilly and expecting Joe Blow to know how to give you the appropriate dose, the right micrograms, the right units, the right syringe. That's why medicine is medicine. Let's not just be doing medicine on our own.
Is GLP-1 and the other peptides that we've been talking about, do they vary by body size? I mean, I weigh 110 pounds. And then if there's a guy that's all bulked up and 245 at the gym, are we taking different doses?
Generally speaking, there are different men and women doses, not necessarily for like GLP-1 GIP. That one is pretty standardized where it's, 0.25, 0.5, 0.75, 0.1 or 1. And who standardized that was the actual branded, because they went through the FDA studies to determine this is the dose that works. This is what it does at this dose. And so it's studied. For something like BPC 157 or other things like CJC, ipamorelin or tesamorelin, those are growth hormone.
I do want to know the difference between those too.
Yeah. So those are growth hormone secretagogues. So to your point, this is why it's so complicated is yes, there are different dosages for men versus women. There are different dosages based upon what your outcome is. Are you trying to shred fat? Are you trying to build muscle? Are you trying to, repair a tendon or ligament? And so I've studied peptides for about 4 years now, and I'm peptide certified by several different peptide, certifications, and I'm still learning every single day, what are the dosages? What are the micrograms? Where are we sourcing it from? So it just really scares me that it is such a wild, wild west out there with peptides. But the other thing that scares me is that it's affecting our ability as medical providers to actually be able to prescribe them, because the FDA is coming in and they're like, we're shutting everybody down because we want to have our hands. We want to know what everybody's doing. We need to know. And so we're just going to come in and we're going to shut it all down, which isn't fair to the people that are doing it correctly.
Right.
And so that's why I'm just urging people, find somebody that specializes in it so that we can do it correctly, so that we can keep giving you guys these things. Peptides have been around in the weightlifting world forever. Mm-hmm. Bodybuilders are probably the most known to have been using peptides forever. And so it's now just coming into mainstream medicine that we're all now having more access to it, but it doesn't mean that it should be as easy as it is right now.
Right.
Yeah.
So tesamorelin and explain those two. And
okay. So those are really popular ones right now. So there's sermelarin, there's CJC 1295, there's ipamorelin, and there's tesamorelin. And they all work on the portion of the brain that produces growth hormone. So back in the day, it was real popular for people to want to do human growth hormone, right? Mm-hmm. The bodybuilders wanted to like build muscle. They would do it in addition to their testosterone. But it's super expensive and really hard to get sourced and not FDA approved. So these growth hormone secretagogues, or growth hormone releasing hormones, are you do a small amount of one of these peptides or combination of peptides. They have to be taken at an appropriate time because the half-life of most of them is like 5 to 10 minutes. So you either take it right after you exercise, or you take it right before you go to bed, because those are the two times that your body naturally pulses growth hormone. And growth hormone is meant to heal, but also to go in and help us build muscle, but it also regulates hormones. So again, it's not something that you want to do haphazardly, because you can mess up your entire endocrine system by doing something. You're actually messing with how your brain releases these things and when they're released. And also, I hear that people are just doing them continuously, and you can grow cancer by doing this. This is what scares me the most about this class of medication, is that it needs to be cycled. So generally speaking, you're supposed to do a 12-week cycle, take a month or two off, do another 12-week cycle. They're not meant to be continuous, and definitely not you do them 5 nights on, 2 nights off, so that the body's not continuously pulsing all that growth hormone, because like I said, it can, if there's cancer in your body, it can actually grow that cancer. So you could be causing cancer if you're not doing it appropriately.
My goodness, it really is the wild, wild west.
It is.
Yeah.
I'm glad I only did CJC, $12.95 for 2 weeks. That's all I could afford. I tried it, but it's because my doctor, Dr. Lassiter, I don't know if you remember him, he was a client, and he kept saying, I want to put you on this. You don't need to be skinnier. Let's do this. And then he died. So I never got on it. So it was always in the back of my mind.
Yeah.
And then I tried it. And
it's great for building muscle, right?
I'm so swole, guys.
But you also work really hard. Like you eat
I work
well,
hard.
You're at the gym, you're doing all the appropriate things. Like you can't
protect your sleep. Yeah.
Yeah. Like you got to do, I don't think anybody should be doing any of these things if they're not willing to master the basics.
Right.
You've got to, that's my biggest thing, is master the basics. And I've said it multiple times, if you're not sleeping, if you're eating like crap, if you're stressed out to the max, if you're not managing your stress, if you're not doing deep breathing, if you're not, drinking water and eating clean food and getting fiber, like, don't waste your money. Maximize the basics first, and then
so do you have to
look into these things?
Shots, or because I know BPC 157, the first time I tried it ever, I just bought it at, I want to say it was at Rip Nutrition.
Okay, yeah.
And I don't know if it worked as well as when I actually injured my shoulder. The doctor, we did shots.
Yeah.
And I did it for a cycle.
So that particular peptide you can take orally. Things like BPC 157, KPV, lorazepatide, GHK copper peptide, that's another real popular one right now, because
I've heard of that.
That's the anti-aging peptide. That one helps to build collagen. It makes our skin nice and soft. So my facial cream that I use actually has GHK copper peptide. It also has...
And we need to know the name of that.
I know, it's beautiful. We get it compounded in Utah, and it's a little bit of testosterone propionate, a low dose that doesn't go systemic, but it's amazing for the skin.
I know. We'll link this in the in the notes.
It also has low dose estriol, which we know that estrogen is important for our skin, but estriol is a weak form of estrogen that won't go systemic for people that can't be on systemic hormones. It has GHK copper peptide. It has hyaluronic acid, which we all know that hyaluronic acid gives us a glow. And then it's just in a really nice, it has some antioxidants in it, and it's in a good base. But there's lots of things right now where GHK copper peptide is being put in. And so if it's not blue, it doesn't have GHK copper peptide. So don't be duped, because there's lots of facial products that are coming out that says, oh, we added GHK copper peptide. If it's not blue, it doesn't have GHK copper peptide. So the actual
product has a blue tint.
Yeah, because GHK copper peptide is this beautiful royal blue. And you can inject it, or that is one that you can take orally. So things like Sermorelin, CJC, you can't take those orally. So again, there's that knowledge base of like what actually works orally, what can be injected.
Well, what about GLP-1s?
So they are working on, there are actually GLP-1s that are oral. And so there's a medication called Ribelsis, which is semaglutide, which is Ozempic, which is Wegovy. You guys playing along here.
What one's Roe? Because I'm a tennis player, so Serena Williams is all over.
Oh yeah, I've seen
the
this.
TV because she's a tennis player and she does Roe. I'm like, what is Roe?
I think Roe is, and I don't specifically know,
a Wegovy,
but I want to say that that's a company.
The name of the company. Probably.
That's the name of the company that is allowing, and I don't know for sure, but allowing people to go online, have a telehealth visit, and then has a contract to be able to do the GLP-1 or GLP-1 GIP.
I think that's it.
I think it's a company. There's one called Him. There's one called Hers. There's quite a bit of different companies where they say, don't waste time going into your medical provider. Yeah. Like, get online, have a medical consult.
Which is horrible to do because I think community is so much more important.
It is. And also, I don't know that they're actually doing all of everything that I talked about.
Like the due diligence.
The due diligence. Like, actually caring about the end game of where am I leading somebody down? Like in my mind's eye, my role is to help you have an end game of living a long, healthy life. Not necessarily longevity in the standpoint of living forever and having a crappy quality of life.
Benjamin Button, no, we don't want to.
But living healthy, living and preventing heart disease and dementia and diabetes and strokes and osteoporosis. And so I don't know that they have the end game. It's a financial thing to them. I know people, and they don't even have to have blood work done. I'm like, well, that makes zero sense to me. But it is. Yeah. It's out there.
It is. It's the wild, wild west again that we're talking about.
Yeah. So,
Gary, Gary Brecka, I'm sure, because he's a longevity guy.
Yeah.
He said in one of those recent podcasts, because I am a podcast junkie, that in like 5 years, we're going to be able to pretty much live forever if we do it right with the knowledge that keeps coming out. Like,
there is so much positive, and I love that
get
we're
rid
turning
of chronic
this
disease.
way.
It will just get rid of it if you take
but it's not a potion, and it's not. The basis still has to be lifestyle first.
Right. If you want to, I guess I should clarify that. If you want to live, you can eat right, take this, and you're going to.
And we can biohack. That's the big thing, is biohacking the body and our knowledge of what we can add to an already healthy lifestyle is immense. But what all those people are talking about is muscle and maintaining and building muscle. So that's a big longevity hack.
Skeleton and all the things.
And hormone balancing. I love that we're in a day and age right now. There's never a better time to be a female because we are shouting from the rooftops how important it is to not be afraid of hormones. And I love it because it is, I see people's lives change every single day. Women that are absolutely miserable, and they find somebody that will actually listen and teach them about hormones. Or even yesterday, I had a patient that came in, and I'm like, you're 60 years old. Have you done hormone replacement therapy? And she's complaining to me about how her knee hurts and her hip hurts, and she has all these issues. And I said, why haven't you done or talked at least about any hormone replacement therapy? And she's like, because that causes cancer. And so I love that I get to have the discussion now. Like, let's rewind all of that negative press that came from 2002 Women's Health Initiative. Let's rewind it and actually talk about the 80 different signs and symptoms of perimenopause, which, by the way, is starting earlier and earlier because of
people not living healthy lifestyles.
People not living healthy, and all of the heavy metals and the microplastics and the BPA, which is called a xenoestrogen. So I see abnormal hormones in such young people these days. And so hormones, so important. They're not meant to be scary, but it's that whole big picture of how do these peptides help you, in addition to knowing what your other lab work is doing. So it is scary that you can just get whatever you want and not necessarily know the risks versus the benefits. But I do love that more people are talking about it. And to me, it's the most exciting part of medicine because it's very rewarding when you can see somebody's life change slowly and intentionally.
Yes. I love that.
Yeah. Okay, we're close on time.
Yeah, we are really close on time.
We didn't even get started.
I know. Well, that's how I feel. I'm like, it goes so fast.
It really does.
You'll have to have part 2.
I would love to do part 2.
We might need to do part 2.
Yeah. I love it because I do know that so many people have these questions
still.
Mm-hmm. Yeah, let's do part 2 because we do need to talk about NADs.
Yeah, NAD, methylene blue. Oh, just
all the IV therapy you can do.
Fun things. Yeah,
and I want to break down a plan for people to make it affordable.
Yeah,
because I think everyone's overwhelmed. It doesn't have to
be crazy.
And so, how can you budget it so that you're actually, maybe cutting out some things that you don't really need in your life, but then investing in yourself and your health.
Yes, exactly.
Your health is your wealth. Like, honestly.
Yeah.
How good is it if you have money and you can't?
It doesn't matter.
There is a way to do it economically and responsibly.
Okay, so we're going to do a part 2.
Yes.
But before we close, give everyone, how can they get a hold of you?
Yes, best way to find you.
Yes, so I am part of Ridgeline Medical, also Ridgeline Longevity and Aesthetics. So they are housed underneath the same roof. And we have an entire IV clinic, hormone balancing, everything. And so either ridgelinemedical.org or ridgelinelongevityanaesthetics.com.
Fantastic.
Yeah.
Okay.
Thank you. Part 2.
We appreciate you so much.
Thank you. It was fun.
I am making an appointment. I'm serious.
Yes. Yeah.
Hold me to it.
I love it. Okay.
I'm getting the facial cream with the copper in it because I need that.
It's my favorite.
Be my Christmas present to myself.
I love it. And you know what? It's not even expensive. It's like $65.
Perfect.
Oh, that's
and it lasts 3 months.
That's nothing.
Okay,
I know.
I'm ordering it.
You don't need the $700 systems.
Do I have to come in and have a visit to order it?
Yes.
Okay.
Okay, we'll make that happen.
All right.
Thank you so much, you guys.
Thanks for joining us today on the We Share podcast.
If you've loved what you've heard, please give us a 5-star rating, tell your friends, and share this show.
You can also follow us for recipes, lifestyle and fashion tips, book reviews, and more on WeSharePodcast.com.
Join our Share Squad and sign up for our newsletter there.
We would love to connect with you.
We share on TikTok, Pinterest, Facebook, and Instagram. Give us a follow.
A big goodbye squeeze and sending you all our love from Alex and Julie.
Join us next week on the We Share podcast.